Good morning. Welcome to this Subject Overview and Scrutiny Committee 2 meeting, which, due to government advice to the public to practice social distancing, will be held virtually with committee members and officers accessing the meeting from remote locations. The meeting is being recorded and will be available via the Council's website to be viewed subsequently. Please can everyone ensure that all mobile phones are switched off or to silent mode. Members will have received an electronic copy of the agenda on Friday the 17th of September 2021. For the record, the agenda can be viewed on the Council's website. Members and officers will be speaking at various points during the meeting, and those speaking may switch their cameras on at that point, but I would ask that, with the exception of myself as chairperson, at all other times you keep your cameras and microphones switched off, as this will help to minimise any background noise and interference and to ensure the connection remains as stable as possible. Please do not use your microphone until I invite you to do so. Officers from Scrutiny will be supporting the meeting and will be monitoring the use of microphones throughout the meeting, and where necessary, will mute those not being used. If any members wish to speak to raise a point or question, they should please click on the raise hand button at the top of the Teams window and I will come to you in turn. Please do not use the instant messenger chat to enter questions or comments. I will now ask the Scrutiny Officer to announce the names of the councillors in attendance at this meeting.
Thank you, Chair. The members of the committee in attendance are Councillor Sean Aspey, Councillor Mike Clark, Councillor Jane Gebby, Councillor Janice Lewis, Councillor Anel Pachella, Councillor Ken Watts, Councillor David White, and yourself, Chair, Councillor Amanda Williams.
Great, thanks. I believe we've got apologies for absence from Councillor Pam Davis and Councillor Mike Kieran. Is there anyone else?
The only other one, Chair, was the Cabinet Member for Social Services and Early Help, Councillor Nicole Burnett, has given her apologies, but we have the leader attending in her place.
Great, thanks very much. I'm not sure if he's joined yet. OK, if we go on to declarations of interest then. Has anyone got any declarations of interest in this agenda? Oh, sorry, Claire, you wanted to come in.
Thank you, Chair. I need to declare an interest in agenda item 5, the recommission of regulated care and support at home, because I've got close family members who are in receipt of domiciliary care living in the county borough. At this point, it's a personal, not prejudicial interest, because we're not speaking of the specific care providers who support my family members. But if we do, then the interest will become prejudicial and I'll withdraw from the meeting.
OK, great. Thanks very much. Has anyone else got any declarations of interest? No, I can't see anyone else's hand up. OK, we'll go on to item number 3, approval of minutes of meeting held on the 17th of June 2021. Can I have a mover and a seconder for the minutes, please?
I'll move them, Chair. Thank you.
Thanks, Councillor Gebby.
Second.
Thanks, Councillor Pachella. Right, OK, then if we've got everyone happy with the minutes, then we'll move on to item number 4, which is the early help and permanent strategy. If I can ask the officer to present the report, and once the report's finished, if any members want to ask any questions, could you please raise your hand and I'll come to you in turn. Thanks.
Thank you very much, Chair. Just to introduce myself formally, I'm Claire Marchant, Corporate Director of Social Services and Wellbeing. I'll just give some very brief introductory remarks on behalf of myself and Lindsay Harvey, the Corporate Director of Education and Family Support. And this is a joint report from Lindsay and myself, but will be presented in the main by 3 group managers who work across the council: Mark Lewis, the Group Manager for Family Support, Stephen Howell, the Group Manager for Placements and Provider Services, and Ian McMillan, the Group Manager for Social Services and Wellbeing. And I think the way that this report is presented this morning hopefully will reflect to the Scrutiny Committee the fact that we do take a whole council approach around our most vulnerable children, young people and families, and look to support them in the most joined up way across education, family support and social services, and working with other external partners as well. I think the report is set out and the appended strategy and action plan show that over a number of years, the Council has taken an innovative and evidence-based approach to targeted prevention and targeted services which aim to prevent escalation of need up to that next tier of service. And as the report notes, and as members are aware, that has resulted in actually us winning awards for that innovative practice through the Baby in Mind service. It's not to be complacent though, and the report does set out a number of risks and issues that we're managing in terms of increasing need and demand for these type of services, not least as a consequence of the COVID pandemic, but not constrained to the challenges that pandemic has caused for all services. The report and I suppose that integrated approach between education, family support and children's services shows how our strategic priorities to keep families safely together where it's in the best interest of children to do so leads to a range of actions really in terms of both those preventative approaches around families, but also in terms of the priorities within our strategy to keep families safely together, reduction expectations as within the Welsh Government priority, and also in terms of increasing our options around placement and provider services, which is where Steve will come in. We very much will welcome the scrutiny this morning, not just on the services that are in place, but around those priorities and next steps set out within the paper. So with no further ado, I'll hand over to Mark and Ian and Steve to take through the substance of the report and the strategy.
Great, thanks very much.
Thank you, Claire. Bore da, colleagues. Good morning to you. Mark Lewis, Group Manager, Family Support. I, with colleagues Ian McMillan and Stephen Howell, will take you through, if in agreement, share with some of the sort of headline messages within the report, and then obviously, with your permission, we'll move to questions from the committee. Yeah, so great. In terms of the current position then, we find ourselves with a revised, as Claire's indicated, a revised strategy, which we're very keen to seek the views of committee and all stakeholders really. The purpose of the report, as you can see in 1.1, is to seek that feedback in terms of that revised strategy, and also the associated action plan where the two directorates interface and where we've got some shared priorities. So I'll take members to section 3 of the report, background. You'll be glad to know I won't be going through it verbatim, but the early help and permanent strategy, key to it is improving outcomes for children, young people and families. We're very keen as a local authority to stop that escalation in the first place, and I'm very proud of lots of the work within early help and that whole system over the last sort of 8 years I've been in post in terms of preventing children coming into that care system and identifying those needs earlier. Clearly key to the implementation, as you can see with the narrative in 3.2 of the report, is that joined up approach, and lots of regulators, including Estyn and Care Inspectorate Wales, have been very complimentary in terms of that whole system approach. But clearly key to it is information sharing and some of the elements there that are outlined in 3.3 and 3.4 linked to that whole system governance, sharing information. We more recently revised the strategy in light of different drivers and priorities, both locally and nationally. As Claire's indicated, they're appended to this report as Appendix 1 and Appendix 2. I will just touch on, I was looking at data actually as recently as yesterday in terms of educare services. So just for colleagues to be clear, when we're talking about educare services within my portfolio, we're talking about Baby in Mind, and they're covered there in the report. We're talking about rapid response, we're talking about connecting families, and we're talking about an integrated family support service. I was really pleased to look at the data yesterday. There's 120 out of the 121 children and young people who were referred to educare services. So that's the umbrella of what I've just articulated there. 120, so that's 99% really, were prevented from coming into the care system. And you'll see, we'll go through it in line by line, but lots of, I think Claire touched on it at the outset, didn't she, in terms of the social care Wales accolade for the Baby in Mind service, very creative, innovative service, and not only dealing with what was a significant gap, but delivering some very powerful outcomes there. Likewise, in terms of 4.6, in terms of connecting families, you can see some of the data there and rapid response. But what I just articulated earlier is that performance is continuing, even within the context, obviously, of a pandemic and some of the challenges we face. I'm going to ask Ian McMillan to come in at 4.12 of the report, and Steve, because what follows is obviously more particular to children's social care safeguarding, and I'll come back in to update members, committee members, in terms of priorities moving forward. Ian, are you good to pick it up?
Yeah, thank you very much for that, Mark, and good morning to everyone present at the meeting today. So I've just taken you to point 4.12 in the report. I mean, I'm delighted to say that we've managed to now launch a new team within children's social care, a really positive move. That's meant the creation of a new team manager post and a new senior practitioner post within the service, and that's a team for our care experienced children's team. This is a piece of work that we've been trying to move as a service throughout the pandemic, and we have engaged and consulted with staff. I'm pleased to say that it's a restructure that was received very, very positively by our workforce. I think there was recognition that within Bridgend that in order to continue to improve outcomes for care experienced children, that the creation of a specialist team to work with looked after children following the conclusion of their care proceedings would add real value. That team is going to be focusing on undertaking direct work, low-level therapeutic work, life journey work, and we think that the creation of that team will lead to an increased retention of social workers within Bridgend, but also improved outcomes for care experienced children. However, our safeguarding teams still remain, albeit with smaller numbers within those teams, and they will continue to work alongside our early help and family support colleagues within their hubs. And that was really integral for us. We were able to retain that model. As Mark's articulated, that interface is absolutely key for us in terms of being able to support children and families in Bridgend. Those teams have now been renamed locality teams, and they went operational on the same day. I think that members will be aware that it is a priority for Welsh Government that all local authorities look wherever it's safe to do so to reduce the population of looked after children within the local authority. That's something that we've been focused on for some time in Bridgend. We were focused on it before. It was a named priority for Welsh Government, and it's something that we continue to focus on. We feel that the creation of a care experienced children team will enable us to do that more effectively. Social workers will have greater time to be able to focus on the discharge of care orders, where children are placed at home with their parents under a care order, but also be able to support a greater number of special guardianship orders. You will see that during the last year we've had some moderate success. The key for us in Bridgend is always the safe reduction of looked after children, and the reality for us is there are still some children within the community who at times have to become accommodated within the care of a local authority, and we will continue to do so because our priority is to safeguard children in Bridgend. However, I think there is some added momentum. Members will see at the bottom of paragraph 4.15, the added focus on this matter has led to increasing the use of special guardianship orders, but also an increase in the number of care orders that are being discharged. I'll now hand over to Stephen Howells.
So thanks very much, Ian, for that. I suppose when we talk about early help and safeguarding, I come in often where the needs and my services come in where those needs have escalated. So the question is, what role do we play? Well, obviously, if we are going to support children and young people where they have become looked after, it's important that they receive therapeutic services in a timely manner. that wherever possible, we support those children to be cared for by their family, and that's in a permanent manner, and that can be with their parents, but also with extended family members, and sometimes that's through, hopefully, through the use of special guardianship orders. And also it's about ensuring we have, placements that are stable, and where we can support children then to safely return home to birth family. So the three areas that I suppose that I fit into this strategy is looking at, first of all, the therapeutic needs. And since the report was written, I am pleased to say that we've now re-advertised the tender for the MAP service, and we are now looking at the date for that contract to start at the beginning of January next year. So hopefully that will support children and young people to receive that therapeutic services when in a more timely manner. Alongside that, we've reviewed our fostering service, and there has been, we are in the process of restructure of a fostering service. And I think this is more of a realignment, I suppose, as I would describe it. It will allow us to work more closely and more alongside and in partnership with the new Care Experience Children's team. It will ensure that obviously family and friends carers receive the support they require, which can be quite specialist and distinct from the support offered to our general foster carers. And also, part of the service will allow us to support permanence much more closely, much more dynamically with those carers who may be wishing to seek to care for children supported with a special guardianship order. And again, in terms of the report and where we are, and we moved on significantly in that, and we are now in consultation, formal consultation with staff, which is due to close on October the 4th. There's no redundancies proposed as a result of the restructure, and we'll be looking to implement the new structure by the end of October. And then in terms of the supporting children, either through placement stability or I suppose returning home to families wherever that's achievable and can be done safely, we have got 4 placement stability workers. And we know that, again, there's been a lot of work, information in the report about the work that they've done, but they will look at how they support children and young people in placement to achieve placement stability. They'll work with the Care Experience Children's team, or indeed the locality teams, to support children to return home wherever possible. What I can say is that at the end of Q1 this year, we again, the services worked well in terms of helping 3 young people to achieve placement stability, supporting the children's teams in helping 4 children return home rehabilitated to the care of their parents, supported 1 private application for a special guardianship order. So in that case, the child didn't need to become looked after. And so has also supported, again, because this is part of our reduction strategy and our approach to really help, we've supported 1 child to return from an out-of-county placement with an independent fostering agency to an in-house foster carer. So that's the information I got, and I'm going to invite Mark back in now to provide some further comments.
Thank you, Steve. Thank you, Ian. So just to move the committee and members then through the report, I'm just going to offer up some narrative and some explanation really to the challenges that are outlined in 4.2 of the report. So COVID pandemic, it's, we all accept that the pandemic has had a negative impact in terms of delivery of services and support to children, young people and families. I think what we are seeing, certainly in early help and parts of early help, are some significant waiting lists. Well, those 2 statements don't sit well, do they? Early help and waiting lists, for obvious reasons. And in particular, there's been a lot of coverage within the press as well, locally and nationally, around children, young people presenting with anxiety and a range of needs on that sort of mental health spectrum. So there are waiting lists there which we are working through. The increase in service demand, you can see that I was looking at data, and 21%, there's been a 21% increase in referrals into early help. And that's compared with the pre-COVID period. So 2019-20, compared to Q1 within this financial year, 21% increase. No increase in funding, no increase in staff. And clearly that's a challenge that we're working through. We have put a growth proposal forward to meet some of that additional demand, because otherwise, our concern is that these young people will escalate through the system and there'll be poorer outcomes and obviously higher cost. I think it's fair to say that there's a workforce shortage, not just across children's social care, but across early help as well. Colleagues have already indicated some challenges in terms of recruitment and retention, and that proves quite difficult in early help. Just to give members some context, within my portfolio that I'm responsible on behalf of the local authority, you're looking at circa 10 million. Over 2/3 of that is grant funding. Now, both the nature of grant funding by definition is time limiting, and we're getting some monies at the moment. And I'm being a little flippant to make the point from Welsh Government, but you get it on a Tuesday and you spend it by a Friday. Well, frankly, you can't plan strategically on that basis. So there's more we need to do, I think, to try and get greater certainty around grant and timescales, because that impacts on some of the other elements that I've described earlier, not least staff retention, because obviously temporary, very short-term contracts impacts in terms of staff turnover. Moving then to priorities and next steps. I won't go through all of these, and these are a lift out of the revised strategy, which is attached as Appendix 1 to this report, but you can see reference to that whole system approach, which is very well embedded. It should say further embed, really, because lots of the regulators, as I've indicated earlier, are very complementary around the interface and the work we do to stop that escalation into statutory services in the first instance. There's more work we need to do. I think Ian alluded to it in terms of, and Claire really, where children and young people maybe are on that threshold and can be stepped down or need an exit strategy into early help. And we need to identify more cases where that sort of step down can happen, so that exit strategy is more robust. There are others which I won't go through line by line, but Steve's touched on recruiting more local authority foster carers, and we talked earlier about special guardianship orders. There's the two final bullet points then: developing a corporate parenting strategy. That's significant in terms of the whole council approach, in terms of improving life experiences for care experienced children. And I think one thing we do well through an assessment process, but not necessarily as well as we could more broadly, is that sort of children's rights, children's participation. So we do have colleagues within, we have two participation workers within my world who do a lot of work more recently. Members will probably be cited on the acquisition of Evergreen Hall, for example, as a youth hub moving forward. So there's lots of engagement there with young people, but I think we need to make that more broad brush moving forward. So in closing then, for my part, the recommendations, Chair, for the committee, as you can see in 9.1 of the report, is to consider the content of the report, the revised draft strategy and supporting action plan, and formally feedback any comments as well on that revised strategy and action plan in line with agreed priorities. Thank you, Chair.
Great, thanks very much. Thanks to all of the officers for a very detailed report there, and it was refreshing to see the whole council approach coming through in that report. We do have some questions. If I could call in Councillor Mike Clark first. He raised some questions in our pre-meeting. If he could come in with his questions.
Thanks very much, Chair, and thank you very much for presenting the report. Mine's a more general question. You did allude to it, but the report is very much concentrated on the supply side in terms of what the authority does and plans to do in order to meet demand. I wonder what you're seeing, if you like, in terms of social change within the demand side. For example, Are individuals and families becoming more self-reliant or less self-reliant generally within the borough? In terms of the way family units knit together, are we seeing a direction of travel that is affecting this, or are we seeing things that are strengthening this? And the third point there is in terms of parenting skills. I mean, a lot has been said about parenting skills, but I wonder whether you're seeing those as being able improving or presenting more of a challenge to the authority. Thank you, Chair.
Mark, do you want to pick up that first point, because that probably starts to bring in some of the work of some of the other teams within education and family support, particularly around, I'm thinking, Flying Start and other early intervention services, even outside of this report.
Yes, Claire, happy to. I think they're very good questions. I'm not so sure at this point, Councillor Clark, I've got a sort of comprehensive answer to that, because you were talking about social change there essentially, and talking about whether families on the back of maybe the pandemic and other factors are becoming, I'm just trying to capture this question before I go off on a tangent, but are becoming more self-reliant or less self-reliant. Is that essentially?
Yes.
Okay. I don't think there is a complete picture at this point. We are seeing more referrals into the system. So let's start at that point. So you then ask yourself the question, where are those referrals coming from? And those referrals are, you know, the biggest referrers into early help services are our education schools providers, and health visitors, and health colleagues. I think anecdotally, and I stress the word anecdotally, we are seeing more challenges and maybe less self-reliance in some areas. You talked about parenting, and that crosses over. We've got the new act coming in, haven't we? Now I never get the abolition in terms of the I shouldn't refer to it as the smacking, but you know what I'm referring to in terms of the new act. We're anticipating on the back of that a lot more sort of parenting referrals. We are seeing a lot more within the early help system for parenting support, where we've got challenges within the family in terms of, at a whole host of levels, really, in terms of maybe those teenage children, in terms of some of the, you know, the challenges they're presenting. But we're also seeing it, Claire touched on services like Flying Start, which are early years. And I know, my understanding at least, is a manifesto pledge, isn't there, to make it more universal in terms of that childcare offer. I would anecdotally suggest that we are seeing, because of some of the challenges presented by the pandemic, a greater demand on services. The challenge is for us, Councillor Clark, is that we don't go in and, in some cases, in an early help context, do it for them and create that dependence. So what we're looking to do is have a shorter, sharper intervention, very clear sort of exit strategies, working with that whole family to try and maintain, because otherwise what we'll get is those repeat referrals within the system. So I haven't got any data to back that up at this point, other than the fact that we are seeing more referrals into the system. But I think lots of families have become challenged by some of the constraints and restrictions that the pandemic has placed on them, whether they be economic, whether they be children and young people for periods of time. Obviously, you know, we're not able to access. We've got, for example, youth support services. Quick aside, you would have, colleagues and members would have seen the article in the press not 2 or 3 days ago in terms of youth support services and that universal element. So youth clubs then, and maybe them not being available, you know, as they were 10 years ago, and not in some cases being able to be open because of the pandemic. So I think it's a very mixed bag. The only data and evidence I can offer up at this point, and I don't know where safeguarding colleagues are in terms of that sort of acute end of support, but there are certainly more referrals coming into the system, which would suggest a greater need. But the challenge is then to make sure that we work with them in a very structured way so we don't create that dependency moving forward.
Thank you for that. If I could come back with the next part of my question, Chair.
Yes, thanks.
Right, and that was relating to many years ago, or often, or perhaps more recently, you'd sometimes see people, the sense that once you get into the system, you can't get out of it. One thing I do see with the thrust of the report is it's very much something I fully support. It is focused on providing this, well, certainly as set out in the strategy, it is on providing the appropriate level of support and trying to exit, when it's appropriate to exit. One obvious question, I guess, is that when support, if you like, is we exit from support as an authority, what sort of safeguarding is in place to just without to be the safety net, if you like, rather than the crutch, to make sure that if something does rebound, someone rebounds a little bit, that we're able to look at that. And if I could add the further point to that, Chair, and that is in relation to the report, I understand and appreciate that the social work is a very skilled job, and that training is something that is regularly reviewed. I just wonder, what is in place for staff, if you like, in terms of some of the hopefully few, but maybe quite harrowing situations that you can't leave at 5 o'clock, even if you are off duty. I wonder what sort of support is in place. And I'm not looking for too much detail because it's obviously a confidential matter, but perhaps the reassurance that, that they're, that we do keep an eye on that. Thank you, Chair.
Thanks very much, Councillor Clark. And if I may just pick up, and other colleagues may wish to come in around step down. In order for the system to work and all parts of the system to work, we need all parts of the system to be operating optimally, don't we? From universal services such as health visiting for very young children, young people, education in terms of their safeguarding role, those targeted services, these very, very targeted early help services, and then safeguarding. And for periods during the last year, 18 months, there were times when some of those services weren't operating. So we saw increases in referrals, for example, from health visiting in the last 2 quarters of last year compared to the first 2 quarters because of the nature of the public health-led restrictions. So I think it was a very unusual year in terms of looking at the data, and in terms of our recovery and rebuilding plans now, we're trying to, I suppose, reset where we need to be going forward, but probably seeing a catch-up in referrals coming through where there had been some gaps in those universal provisions for very understandable reasons that we know that the public health crisis took predominance. We're also still working through, I think, across multi-agency partners, understanding the impact of the pandemic in the medium and longer term, as well as the short term on children and families. And some of that is playing through the system, isn't it, in terms of referrals that are coming through, where we're seeing that impact over a period of time. So all services, including, early help, IAA and MASH, are seeing a significant increase in referrals at the moment compared to where we were previously, and certainly during the pandemic. You talk to people and they use the word complexity quite a lot, so seeing more issues in individual sets of circumstances perhaps than previously, and what we need is the system at some point to reset. For me, one of the challenges and one of the things that we look at is that there's the capacity in early help that we can safely step down from safeguarding when we need to do so. So I'm just looking at the quarter one figures from this year, and we saw 100% of the children step down from safeguarding into early help remained open. That's a good thing for me, but as Mark has already indicated, there are real challenges and that pressure bid from early help to make sure we've got the right capacity for both keeping those initial referrals and preventing any delay in individual children and families stepping down into early help. In terms of staff support is something which as a service we are very, very focused on. In terms of social work, endemic in social work is supervision. And that's clinical and professional, as well as personal supervision is absolutely fundamental. That opportunity to reflect and making sure that time is set aside, and that's always a challenge, time, isn't it, but for reflection, and making sure that there's access to specialist support in terms of reflection and counselling when things are particularly challenging, and make sure that that access is very timely. So we've certainly been working through that with HR colleagues to make sure that that is in place when our staff need it. We're also very focused at the moment, and there's some specific Welsh Government investment that members will know about this year around social care recovery, and we are focused on spending a significant amount of that fixed term money this year on supporting our staff in terms of their own personal recovery from working in the front line during the pandemic. So looking at things such as each team having a development day, an opportunity to reflect as a team of their experiences over the last 18 months, as well as that bespoke individual support and developing communities of practice going forward. So those are the sorts of things which are really important that we build in for our workforce. It may be Steve and Ian want to build on that from a social work perspective.
Thank you. One more, if I may. It comes out obviously out of the discussion. You also mentioned that, or I think Mark mentioned that there's a significant amount of the cost, the financing of service comes from Welsh Government grants. And obviously, the way things are done is the way things are done. But the strategy that you've put forward is a strategy that will take some time to bed in and develop. So to a certain extent, is it dependent on what you, I guess, hope, think, or guess that is the funding that will come forward from Welsh Government for years to come? My question related to that is that the same approach? Is the same approach taken in the other nations? You know, Northern Ireland, Scotland, and England. Is that the way social work works everywhere in terms of most of its grant funding?
I don't know the answer to that, Councillor Clark. I'm afraid I don't. My assumption is that there's equivalent. It's now called the Children and Communities grant, which was formerly Families First. I think that got that title right, Mark, which funds significant parts of early help and preventative services. Mark, do you know if there's an equivalent in England?
You are correct in terms of the acronym, Claire. You'd be glad to know. But yes, there are equivalents in England. I think the important point to make, Councillor Clark, is social workers generally will be funded through core budgets. What I was alluding to in the report is clearly we need to invest and have invested in preventative services to try and stop that escalation into statutory services in the first instance. Those services that predominantly, not exclusively, but predominantly fit under my portfolio are grant funded. So we can't plan strategically. So when Claire talks about whole system and she talks about capacity to step down, that's the fragility that presents. There are grant arrangements in England. I don't know what they're entitled. And you know, and I guess we've always got to be careful, haven't we? Be careful what you wish for, because if you take away grant conditions and then it's not earmarked, then you know it can escalate and you know be spent you know in other services. So I be careful not to shoot myself in the foot here. But my point I'm making is when you're talking about staff morale, staff retention, strategic planning, an annual fund doesn't allow you to do that. Doesn't allow us to, you know, staff have got mortgages. Staff will move on anyway in early help. I think it's a good career pathway in some instances to go into maybe qualified social work and others. So it's not about standing in people's way, but I think having, you know, as I speak to you now on the 23rd of September, colleagues don't know, many dozen, whether they've got a job in April. Well, that's not acceptable in my view, and that doesn't allow for the strategic planning. Now, there's things that we can do as a local authority to look at that, because frankly, many of them have probably got 10 years service and have got the same employment rights, frankly, as anybody who's on a permanent contract. But that is the fragility within the system. But I think I can look at how the grants and what they're entitled within, you know, England, Northern Ireland, and so forth. They will be there.
No, I'm fine about that. It was a general point. I'm fine about that.
But I think the general point I just wanted to clarify is social workers, not exclusively, because you've got social workers within the Youth Justice Service, for example, that comes under my portfolio, that are funded out of grant. We've got social workers that are funded maybe in some of the educare services, but predominantly I would suggest in Claire's world that they would be co-funded. I just wanted to make that point.
Thank you very much.
Can I just bring in the leader, because I think he's put his hand up to come in on that point.
Yeah, well, thank you very much, Chair. It was on that point. I think it's a good point and question that's been asked by Councillor Clark, and the group managers outlined the difficulties that grant funding can create in terms of uncertainty for the workforce. So just to reassure colleagues, that is something we're considering at the moment. My view is that even if we have to take a risk as a local authority and make a commitment to some of these services, then I think we should be making the commitment, because these services are invaluable. Even if they were not grant funded, it would not be sensible to pull the plug on these services, because we know they keep children out of care, basically. These are edge of care services. There's a huge amount of evidence that they are effective and they deliver better outcomes. And if we didn't have them in place, then we would have to spend a lot more money on services in statutory services, social care, and accommodating some of these children, because they wouldn't be with their families anymore. Welsh Government are very committed to this agenda. We are trying to move them from the grant-funded model. And I don't think there's any question over the next couple of years of there being less investment. I think there's a recognition now, not just in Wales, but across the UK, that there needs to be significantly more investment in early intervention and preventative services. So hopefully with members' support as part of the medium-term financial strategy, we can make that commitment to these services. And we will look to do that possibly before the budget, because what we're also finding at the moment is that there's additional funding being made available by UK government, by Welsh Government for social care, because at last there's a recognition of the importance of social care and early intervention and preventative services. And we will obviously report back to members about that, because as has also been reported, the services are under strain at the moment. We don't want anyone waiting for these services. We want the services to be made available as quickly as possible. So we will also considering how we can scale up some of these services now to keep children safe and to keep them supported and with their families where it's appropriate to do so.
Thank you very much for that.
Thanks, Chair. Thanks, Councillor Clark.
Okay, did you have anything else, Councillor Clark, to come in on that, or are you happy with all of the answers given?
I'm happy with the answers given. Thank you very much.
Right, okay, thanks. Can I bring in Councillor Janice Lewis now? I can see you've got your hand up.
Yeah, thank you, Chair. Interestingly enough, the Flying Start question is one of mine, actually. I just want to know what the impact has been on the Flying Start in the perspective of helping families. And also then, are you, because obviously you're saying you have an extra referrals, most probably coming out of the Flying Start areas. Have we thought about extending the Flying Start service? Those are my two things. Thank you, Chair.
Thanks.
I'm happy, Chair, to take the question around Flying Start. It's within my services. in terms of Flying Start, the first thing I want to say at the outset, it's been hugely impressive, as of many services over the pandemic. If you think, and I don't want to turn this into a beauty contest, but the schools had to close and Flying Start settings remained in terms of their delivery to preschool, and you can imagine things like social distancing, quite frankly, are impossible in that environment with preschool age children. So a big shout out really, and a big thanks to colleagues within Flying Start, particularly within the childcare settings I'm talking about throughout the county borough, throughout the pandemic, delivering those services. In terms of eligibility, then members are probably cited in terms of what the eligibility is, in terms of geographically, and in terms of Flying Start being delivered within a programme which is essentially a deprivation, or in areas of deprivation, the programme is delivered. We do, your question then, so in terms of Flying Start, there are key elements to that. One is childcare, one is parenting, one is the enhanced health visiting, and we've got some other enhanced supports that go in as part of that Flying Start offer. So we've delivered that model throughout. Your question in terms of, I think, was around impact of Flying Start. That, frankly, is always more challenging. We know early intervention works, as the leaders indicated. That early intervention, you can't get, in there earlier in terms of that sort of early help type model than Flying Start, really, in some instances. What is more difficult in terms of, and you're going back probably 10 or 12 years now, is in terms of how the Flying Start programme was established across Wales. They didn't have sort of longer term measures, because I think what's more powerful is if you look at a cohort of children that have gone through a Flying Start, say, provision and childcare, and those that haven't, and then look at things like educational outcomes and other outcomes. And that isn't something, to my knowledge, that's ever been tracked on an all Wales, and it's more difficult to track as well at a local level, given the numbers that go through. So we do know, because we work with a number of these young people, because they could be open to a range of other services, that the feedback we get on a qualitative level as well is very positive in terms of the Flying Start model. In terms of some of the sort of harder outcomes, in terms of those educational outcomes, I don't have that data available, and I would suggest that that's not available on an all Wales basis either, because the programme wasn't established on that basis. But we do know as a model, in terms of early intervention, it's effective. And as I indicated earlier, my understanding is the new Welsh Government within its manifesto is actually looking to make that childcare arrangement universal across within its period of government. In terms of referrals, we do, Councillor, as you say, see a lot of referrals that come, and what I've done really, because in many ways I want to move away from programmes. The end user is interested in the service, in my view, and the outcomes from that service. So we do have, for example, some family support workers who are funded out of Flying Start, but they sit within that integrated delivery model. Now we have health visitors, so there's lots of professionals who will refer in, because what we're very keen to do is not create an island, if you like, whether that be Flying Start or other services, and look at that join up. So we have seen, I haven't got the figures to hand, Councillor, but we have seen additional referrals coming into the system at both levels, really, if they've escalated straight away through to CP and safeguarding through to MASH, and actually in an early help context. So I think in summary, Flying Start, I lose track of time now, 10, 12, maybe more years in terms of a Welsh Government flagship anti-poverty type agenda there. We're really proud of the work that's been done in Bridgend, and particularly throughout the pandemic. The need is there. I think in terms of rollout, I think that was your final point. We were certainly looking at, we've got things like outreach within Flying Start, so can work outside some of the anomalies that present, that one side of the street is eligible and another's not, because that's hugely frustrating. But we do have other services as well that are not Flying Start related, so we're not governed by postcode in essence, that can support children and young people and families in need. So I don't know whether I've answered all of your points there, but happy to answer some additional points if I've not.
Sorry, Chair, can I just come in?
Are you okay? Yeah.
Yeah, I'm very happy, and I'm happy for the last couple of sentences where you actually said that you can outreach and making it available, that type of, I'm very happy with that, because as you say, one street will be in Flying Start, the next house is not in Flying Start, but you're in the same area. So that is really nice to hear from you. Thank you very much indeed, and thank you, Chair.
Thanks very much. Okay, can we move on to Councillor David White then, please?
Thank you, Chair. My question is more to do with education. I think around mental health and children in schools. Although, like you say, there's a barrier around mental health and there's a waiting list. What supports are schools putting in place for children, especially with the return of schools now over the last few months? Because I would say there's been a noticeable increase within schools on mental health and anxiety. So what supports are in place for education for kids in school, coming from the education schools themselves? And on the other end, what is the position stopping us from getting the services for children with extreme, mental health and anxieties? Are there any negotiations with partnerships with health? What's preventing them getting the services?
Okay, great. Thanks. I bring in Lindsay Harvey to answer that for you.
Thanks, Chair. Thanks, Councillor White. For the benefit of the recording, I'm Lindsay Harvey. I'm the Corporate Director for Education and Family Support. I'll start off the response from a school-based perspective, Councillor White, and then invite colleagues, then Chair, to look at specific services. So with regard to schools, there's a number of elements already in place. So first of all, internal support. So this is support that's offered on a universal basis at school level. So this might be available through personal social education. It might be available through individual activities within schools to support the needs that are raised by learners on an increasing basis, especially as we leaving the sort of complexities that we had last year, and more learners are coming into schools. So there is a challenge there. In addition to that, there's a range of bespoke services that are offered by the local authority with regard to education engagement, with regard to school-based counselling, and a range of supports is offered through the Educational Psychology Service. Their more targeted support then is offered via our colleagues in health. So with regard to CAMS, as I'm sure that a lot of colleagues will be aware of. But I think what's very clear here, and I think all members on this call will be aware of, is that there is a growing demand. The resources are finite. The challenges we're having from schools is certainly, it's been exacerbated by the pandemic. And what we are seeing, we're seeing more and more need for these bespoke services in schools. So I suppose there's two things really from a local authority that we are driving forward to support this. First of all is the creation, in conjunction with partners and Welsh Government policy, of a regional mental health strategy for children and young people. And that's obviously very important that we avail ourselves of a regional resource. And also the key thing then is to work with schools to identify some of the emerging issues that are coming out of emotional well-being and mental health needs that are being identified at a school level. So I'll bring colleagues in with your permission then, Chair, to look at individual service areas. Certainly from Mark Lewis's world, we can talk about some of the work we do within the education engagement team. And then with your permission, Chair, with Nick Chanis, who's also with me today, to look at some of the wider service delivery around mental health, if that's okay. So if it's okay with you, Chair, I'll invite Mark in first, then Nick.
Yeah, okay, great, thank you.
Thank you, Lindsay. Thank you, Chair. So there are a range of services available to support pupils then, if it's in an education setting with their sort of mental health needs. We've got at primary school level, we've got emotional wellbeing workers that support children of primary school age in terms of their emotional wellbeing. That's a referral led service. Again, is funded by grant. I go back to the point around grant, and that's actually funded through something regionally in terms of the ICF monies. Well received, and as you can imagine, that service is oversubscribed. So we do have that service, but obviously greater needs are emerging in terms of what myself and colleagues have indicated earlier. Within secondary schools, not moving beyond the internal arrangements they have and some of the inclusion-based sort of ELSA and other approaches that they use within schools. We've got school-based counsellors that the local authorities employ. Again, they are oversubscribed in terms of a need, and that's always a challenge. I think there's more we can do and should do in terms of triaging that need, because in some instances, if there's been some background conflict, for example, that doesn't require school-based counselling to make the point. It needs, we need to be very clear in terms of that need, and obviously the waiting lists and the identification is managed by schools. We've also got community-based counselling, tends to be for sort of 16 or 18 to 25-year-olds, but if individual and pupils don't want it within a school setting for perceived reasons of stigma, they can have community-based counselling. We've also recruited more of late through some of the time-limited monies, play therapists. So that is, a higher level of need, but obviously younger children, and therapy through the purposes of play. So there's a range of services available. Is there enough? No, but I think some of that is to do with increasing demand, and we're looking to plug some of those gaps with some of the more time-limited money that is coming. We don't have a lot of these very qualified, trained people, these school-based counsellors and other counsellors who've gone through quite a bit of training. There's not a lot of them waiting there to be employed, so we are fishing in terms of recruitment from quite a tight pool. I think colleagues within children's social care would be better placed than me to talk about the CAMS service, and I think we've talked to Scrutiny and members for significant periods of time in terms of some of the challenges in terms of young people accessing child, adolescent mental health services. So we have other arrangements, and I think Lindsay mentioned the education engagement team. The education engagement team, just for members to be clear, is what was something that I pulled together probably 5-6 years ago or more now, which is an amalgamation of what was looked after children education, child protection, education, educated out of school, and Gypsy Traveller, a range of other services there. Now that's well managed, well received service by schools, led by somebody called Gail Biggs, who's a very competent officer, and they work with individual schools through their resource to, on a bespoke basis, support some, a range of young people who might be identified as vulnerable or might have, a particular status in terms of child experience or looked after that requires maybe some, not always, but requires some more support and monitoring. So in summary, from my perspective, there are a sort of plethora of services there, and we are better placed than we have been for some time in terms of, but what we've had is this small matter of a pandemic, and some of those needs are increasing. And what we are trying to do through a one front door and through that referral pathway is to, if you like, triage those young people and pupils to the right services, because lots of them might not need that more therapeutic or sort of counselling based intervention. So there are other services that we we can put in place as well. So demand is increasing, and obviously we're not keeping a pace with that at the moment, but we are quite blessed, I think, at this point in time with the range of services available. I don't know, Nicola, whether you wanted to add to that, or whether you wanted colleagues to come in from children's social care in terms of the particular question around CAMS.
Thanks, Mark. For the purposes of the recording, my name is Nicola Chanis. I'm the Head of Education and Family Support. Just a couple of things to add, if I may, Chair. Just to be clear, what we're talking about, really, we're talking about a huge gamut of need, as I'm sure Councillor White knows very well, from that low-level well-being kind of need right up to your actual sort of mental health where a CAMS or a health input is required. And schools are very well aware and very able to deal with those earlier lower level needs around well-being of pupils, and as Mark has really well described, there's lots and lots of services to support them in doing that, not least of which, of course, our educational psychology service. But we are always looking to develop those services and those expertise, both within Mark's area and Michelle Hatcher, who leads the educational psychology services area. And we have recently become involved within Cwmtaf Morgannwg, a regional wellbeing strategic group. So we are looking at how we implement strategically wellbeing interventions across whole schools in the region. And key to that is part of what is called the NEST framework. And that's around making connections for children and young people who need support. So they may not be formal connections. They may not be referrals to services, but it is about identifying the young person and their needs, and then saying who is best to link these people into, these young people into, and their families sometimes into, in order for them to move their well-being on in a positive way. So we are part of a pilot where we're working with the whole school approach to the NEST framework. We're also looking at how we implement the NEST framework more widely within our service areas, so that we can develop a mechanism for kind of a common mechanism across the health board region for identifying low-level well-being / mental health needs, and then addressing them at the very earliest points. And I'll hand over to my colleagues in social services who may want to talk a bit more about some of the more high-level needs. Thank you.
Yeah, thank you very much for that, Nicola. So I'll focus on sort of the spectrum of more complex needs. But just to add, it's been really welcome over the last year to see a really focused regional approach in terms of this matter. The emotional health and well-being group has met, and there's a clear focus within the health board now in terms of this escalation and concern in respect of children and young people's mental health. I'm part of the writing group for that subgroup, and in addition to there being a regional strategy, there's going to be a local implementation plan which is being developed. One of the successes that we've certainly had in the last few years is when we created the multi-agency safeguarding hub, was to have a emotional health and well-being worker, a qualified mental health worker, placed within the IA service. That worker has provided invaluable advice and support to social workers within that team in terms of emerging mental health issues. Has been able to carry out direct work with children and their families, and at times be able to de-escalate need, but also to support that service in terms of the correct referral routes in the event that those needs are increasing. We've used ICF funding to support us in terms of that role, and we've been able to evaluate it as making a real difference. In terms of working with CAMS, I think it's fair to say that at times there are real challenges. There are significant pressures. I think members will be aware. They will have read reports in the media to say, there is essentially at times it feels like a crisis within the CAMS service in terms of the pressures on that service. To receive a service within CAMS, you have to really have an extremely high level of need, and you also often need to want to engage with the support provided, which a lot of young people and families at times are not comfortable to do so. However, we continue to work closely with CAMS. I chair the transition panel within the local authority, and we do have CAMS representation on that board, and that's really helpful for us in terms of being able to try and plan how we will support young people with very complex needs, which often may be described as behavioural needs, but would verge on needing mental health support. In addition to that, there are often times when CAMS referrals are refused, but that doesn't mean as a local authority that we don't look to offer a service to our care experienced children. Steve has talked a little bit earlier about the development of the MAP service, and the fact that we will be having specialist therapists who have the skill set required to provide support to children with those complex needs. In the interim period, we use our accommodation and permanence panel to identify the appropriate therapist to carry out that support. Because of the nature of children who come into the care system, they often have really complex needs, often relating to their attachment to their early life experiences, and we often refer to specialist therapists, psychologists who have the skill set required to meet those support needs when our social workers don't have that skill set themselves. So in the event that CAMS aren't able to fill that gap, then we look to pick that up as a local authority. I think in summary, we continue to work closely with CAMS. It's I personally have got relationships with a number of the sort of senior consultants within that service, and it is a closed working interface, but there are still challenges in terms of getting the right number of children and young people into that system because of the pressures.
Thanks very much. Councillor Hugh David, do you want to come in as well on this?
Yeah, thanks very much, Chair. Mental health and wellbeing is consistently raised with me by, for example, Bridgend Youth Council and other representative groups of children and young people across the county borough, and I've been very keen from the outset, as someone who's asked for this strategy to be put in place, that it's a multi-agency, multi-partner strategy around mental health and wellbeing, because of the critical role of the health board, the authority, schools, the third sector. So having that support is welcome, and it's important to making this a success. But we will also be ensuring that the voice of the young person is at the heart of this strategy, and that there's very effective engagement with children and young people on how we develop this and the action plan around it. But I would also in particular welcome the input of this overview and scrutiny committee. So when it's at a stage where it's ready for you to consider, we'd really appreciate members' thoughts and views on that. And we'll be looking to get this strategy in place as soon as possible. And another key strand of this work is how we develop that workforce, because colleagues have articulated how there is a real shortage of some of the most specialist professionals. So we do need to think about how we can, for example, grow our own in terms of therapists and counsellors, because there is an increasing demand for those type of specialists. And that's where we want the focus to be, is on people that can do direct work with children and young people and provide that support. Colleagues have talked about, for example, the very powerful impact the play therapists can have on children, and I've seen that myself, and it's remarkable. So our focus will be on that, as well as direct work with children to provide that additional support. Thank you, Chair.
Thanks. I can see Claire wants to come in as well. Thanks.
Yeah, only really briefly, if I may, Chair, just to follow up on the point that the leader made around workforce, because we know it's one of our key challenges right across the piece, but there's been some really innovative practice around looking at different types of skill sets to meet these needs, particularly around, in children's services, the behavioural analysts. And I wonder if Steve just wanted to come in and talk a little bit about that, because it's an example where we've looked at the workforce that is available rather than trying to recruit constantly people with workforce backgrounds that just don't exist out there. So Steve, I just wanted, if you wanted to tell Scrutiny a little bit about that role.
Yeah, so we've currently within children's social care got a employer behaviour analyst. They're based here at Mapletree House, and their role here is obviously quite a specialist role. They'll undertake assessments of children and young people who come into the service here, and will think about their sort of and identify the most appropriate move-on placement for them from Mapletree House. But a key part of their work is understanding the child's behaviour, where the child's behaviour, what triggers those behaviours, and what function those behaviours serve. And key part of the assessment is identifying therapeutic needs for children and young people. But what the benefit of employing our own behaviour analysts and having them on site here is what they work closely with the staff and develop protocols to support staff to work in a particular way, specifically focused on the individual needs of each child and young person. I know that as part of the recovery plan, we've already discussed whether or not we can enhance that service. Because what we see here, we could use those same skill sets and develop those skill sets. Again, we've talked about our practice support workers, how we can enhance their role by supporting them and developing some of their skills and knowledge and understanding in this area. But also to support our foster carers and help to improve their understanding and how they interact and work with the children and young people to support the children and young people in their care. So and again, we are looking at how, just to reiterate, we looked as part of the recovery how and whether we can enhance that service that's available to social work practitioners as well, again to support some of that earlier intervention, I suppose. So what we hope to do is, by doing some of that work in a much earlier stage, we can prevent the need for every child and young person needing a specialist therapist to work with them, and maybe we can, sort of tackle problems sooner, to prevent escalation in need.
Thanks very much. I think Councillor White wanted to come back in then.
No, just to one point, just to say thank you for the comprehensive answers. And it's good to see, that the strategies are in place, and and although we can never be able to meet the demands of the service, as much as we would like, it's good to see this range of services in schools and the way you champion our kids. If we can ask one more question, Chair, just a quick question in regards to reducing LAC numbers. One of the biggest costs is out of area services, and as councillors and everybody in the committee would always say children's must come first, and what they need must come first. But where are we at the moment with reducing numbers in regards to out of borough services? And because as we know, because some of these can be quite expensive. So where are we at the moment with that?
Thanks very much for the question, Councillor White, and I can see that Ian wants to come in, but just to say that we have seen a small increase, but small means significant financial cost in the number of residential out of area placements that we've had to make. But I think we're very confident when we've had to make those placements that they have been in the best interest of each individual child, following very, very thorough assessment and care planning of their needs. But I'll allow Ian to come in and give some further detail.
Yeah, thanks for that, Claire. I think it's important when we talk about out-of-county placements, we talk about each individual child or young person and what is the right plan for them. So our ethos within Bridgend is always, wherever we can do, is to place a young person within their community. Now, sometimes there are reasons that child or young person needs to move out of the Bridgend community, and when that happens, we work with colleagues in other local authorities or private agencies in areas that we consider to be safe for that child or young person. This is an area that we've actually made a lot of progress in, and there was quite a significant reduction both in terms of cost and the number of those places. However, as Claire's alluded to, we have seen increase within the last 6 months in terms of the use of those placements. In each case, certainly I've overseen, and so has Laura, and Claire has been involved in terms of that decision making. The independent reviewing officer has also been involved in terms of that decision making, and we've been clear that it's been the right care plan for that child. We always review those care plans. I chair the LAC strategy action plan meeting, and we look at each child and young person that's out of county. Laura, as the head of service, chairs the out of authority panel, and she always also reviews those placements. Often when a child becomes settled in an out of county placement, it's not right for them to move back to the Bridgend community until it's been an assessed need. Sometimes it's those children's and young people's wishes and feelings to remain within that placement where they have been settled and they're happy with that support. And it's really important in those times that those children remain in those placements, and there's always a balance in terms of cost. So we will always look to bring those children back to Bridgend, but there will always be some children and young people who will stay outside of the Bridgend community who are looked after.
Thank you. Just say thank you for your answer. That's all, Chair. Thank you.
Just a second. Yeah, did you want to come in and answer as well?
If I could just briefly, and I think just building on what Ian said, and I'll try and keep it brief. I think just to be clear, the number of children we've got placed in independent fostering agencies is the lowest it's been, sort of certainly for many years. What we have to recognise when we talk about out of county is many or a number of children are placed out of county, but they are with Bridgend foster carers who live in neighbouring authorities. And a large number of children who live outside of the county boundaries are placed, in fact, with family, with members of the family, in foster care arrangements. And again, we've touched on as part of earlier discussions about how we work with those family members and where it's right and it's in the best interest of the child, look to support those family members to achieve permanence for the child through the use of special guardianship orders, which obviously would reduce, that would lead those children to no longer being considered looked after by the local authority. One of the big areas that we did recognise is, well, one of the matters that we often see children moving on, they feel like the complexity of their needs growing is when they bounce from placement to placement, for want of a better description. We've introduced some interim guidance for our staff and introduce a RAG status to consider where there are concerns around placement stability and the expected response from our service to support placement stability. And also we've done a more in-depth or more in-depth dive into a review of placement stability and is in progress, so we can look at what further steps we can implement to support children remaining in placements. And obviously, sort of again, preventing that escalation in needs that often leads to children then at some stage down the line being placed in quite high cost out of county residential provision.
Okay, thank you, Stephen. Thank you.
Thanks very much. Can I just jump on this question? I had some questions on out of county placements, but have we got enough foster families in the county? You mentioned that we're reliant on independent foster carers less and less, but has COVID impacted the number of foster families we've had available? Thanks.
So do you want me to answer that, Claire, or do you want to answer that?
I think you'll come in, but I was just going to say, no, we don't have enough foster families in the county borough. You'll have seen just this week a big push in terms of communications around Foster Wales and the Bridgend sort of communications releases attached to that. And I think we always take this opportunity to say to members when we are in front of scrutiny committees and talking about fostering, if there's anything that you can do through your local newsletters to promote the communications that there are to signpost people who are considering potentially taking that step into fostering, to pick up the phone and have the conversation with us, then please do so. So it was just a plug before Steve comes in with the details.
That was a very good plug, Claire, and thanks for that. It saved me doing it. But certainly, yeah, I mean, the short answer is that we know we haven't got enough foster carers. Here we've currently got 93 foster carer households, have general foster carers and 63 households of friends and family carers. You know, we talk about some consideration to the number of new carers. We need to increase that by, I would say, a minimum of 10 carers per year in order to get to some sort of stage in the next 2-3 years where we've got sufficient numbers. What we should never, or we wouldn't want to be, is at a place where every single one of our placements is being used, because each household will be approved for different numbers of children. And I think it's really important that we not just have sufficient numbers, we have numbers to exceed, I suppose, placements to the number of children who need to be looked after, because that way we can ensure that the child, who needs to be looked after, is placed with a carer who is absolutely best suited to meet their individual needs, and where, you know, so I think, yes, we definitely need to increase. I think, as Claire's touched on, as part of the work of the National Fostering Framework, we've seen the development of an All Wales brand, I suppose, in I should say Cymru Maethau or Foster Wales, to support a national recruitment of local authority foster carers. And I suppose part of the thinking of this is to put us on an equal footing in terms of many of the independent fostering agencies, in terms of being able to get the message out there, and to really highlight the massive shortfall of foster carers, not just here in Bridgend, but across the whole of Wales. And that's really gone live, and many of you, I'm sure, or I hope many of you, saw the adverts that went out earlier this week during Coronation Street, to start some national promotion of the need to recruit more foster carers. I suppose in terms of the impact of COVID, I don't know, I suppose strangely, I would say, perhaps I expected it to have more of an adverse or negative impact on the recruitment of foster carers. I think last year we actually had a net increase in terms of our numbers of foster carers, which was, again, the first time in many years. We actually approved 16 new foster carers during the course of 2020-21, which, yeah, was a significant step forward. It was 100% increase on the previous year. So maybe we weren't anticipating such a dramatic increase, but it was nonetheless, it was refreshing to see. I wish I could give that real good positive feedback so far this year, but we've seen the number of new inquiries to date this year dip dramatically. But again, what the instant feedback is on the back of the adverts that have gone up this week, we are seeing the numbers of foster care inquiries starting to go back up again this month, which, yeah, hopefully now with this launch of Foster Wales, that we will see those numbers continue to grow over the rest of this year. And I think at the moment we've got 4 foster care assessments in progress for so far this year, but hopefully we can see an increase in that over coming weeks and months.
Great, thanks very much. A couple of questions we had in our pre-meet. The one question that came up was that the strategy looks good on paper with regards to the potential success rate and the reductions in figures, but what does it look like on the ground? I know we've had some of the answer given in specific areas, but it's a general question. I appreciate that. But I don't know, Claire, if you're able to come in and help with this.
Yeah, the figures are the figures. I always think that in terms of performance, and I think this is why if I pick on the reduction expectations element, there was so much debate around that as a policy intent, really, to turn it on its head. We want more children and young people to live as safely as possible with their own families in their own homes and communities, so the positive. So I would highlight, really, within the action plan, you can see that there's work around quality assurance, and I think alongside monitoring the figures and reporting them through to scrutiny and into CPA processes, we need to be doing that deep analysis around what this strategy actually means for children and young people. And I guess that's at the heart of that question around on the ground. So the commitment I can give you is that quality assurance is embedded within the strategy and action plan, and we will be very focused on that element and hearing the voice, which we've talked about already in the Scrutiny Committee, of children and young people in telling us what works and what's not working. They're very good at doing that. So I think that will be the evaluation and the judge of the success of the actions that we've got here. And it's very much a live strategy and action plan as well. So we've got the meeting of the Early Help and Permanence Board, which Lindsay and I co-chair next week, which oversees this. And if there's actions in here that needs to change and adjust, that will happen as we work through. But we're very focused on the evidence about impact being qualitative as well as quantitative.
Thanks. You touched on the one bit, is one of my questions. You're keen to seek views of stakeholders, and so how do you do that with the children and the young people?
I couldn't unmute then, apologies, Chair. Mark Lewis, in one of his answers, talked about the engagement little team, very small team, I think, Mark, that sits within his directorate. That's one mechanism that we use. We have the Youth Council, which are very interested, as the leader has already said, in certain aspects of what we're doing, particularly around emotional health and well-being. And then we refer in the strategy that one of our key priorities is to develop that corporate parenting strategy, and it may well end up being called something different, because it's a title which often doesn't mean much to a child or a young person, corporate parenting, and that's got to be very, right from the start, driven by our children and young people who are care experience. It's got to be written through their words, it's got to reflect their experience, and it's got to challenge us as a council and other statutory and non-statutory partners about what matters to those children and young people. And we've got to use a range of mechanisms. I held a couple of focus groups in the lead up to my annual report, trying to work with care experienced young people, and they weren't very well attended. It was really qualitative conversations with the small number who did attend, but it was clearly not the right way to do it. We get very in-depth information through from our independent reviewing officers, and that report is due to come to the next corporate parenting committee, and there's engaging children and young people in their own reviews gives real insight as well. So I think it's a whole range of mechanisms, and it's got to be what's right for each child and young person, but we've got to make sure we hear that range of voices in telling us what's worked and what doesn't work in these strategies, right the way through from the feedback through individual reviews, as I've talked about, but to those more systemic mechanisms as well.
Great, thanks. I think Mark wants to come in.
Yeah, only very quickly, and the next door neighbour has decided to bring a tree surgeon in, so apologies for the noise in the background. I just wanted to pick up on Claire's point around, really, we need now as officers and as a local authority, and we're on that journey, to be more creative in terms of, and use different platforms really in terms of how we engage with young people. So, for example, I indicated earlier that we've acquired, which is a great acquisition, Evergreen Hall, working towards a youth hub there. We held a number of drop-in events in line with the risk assessment, I'm hastened to add, in terms of COVID. But really, the majority of young people don't want to engage through that platform. They want to engage through Instagram, or they want to engage through other social media arrangements. So within, just an example, within my area, I can send the link through to members, but we've developed with colleagues a WhatsApp, as opposed to a WhatsApp arrangement electronically, where children and young people who are predominantly open to youth support services, but not exclusively, can not only share ideas, but it is a mechanism for gaining their views on services as well. So there's an example, and I haven't got the sort of figures in terms of usage, but it's been significantly used within that area. I think my point in a clumsy way is, I think it's great that we all do, and we should be visible, as leaders and as officers and as practitioners. But many young people, and I've got 2 teenage sons myself, will want to engage through those sort of social media platforms. So I think my point, Chair, is that we probably need to do more to grow that across the different directorates as a mechanism for seeking those views. So yeah, just a view on that.
Okay, great, thanks. I've got a couple of questions that have been sent to me on the report. Firstly, page 20.2, it says the strategic plan for early help. If good outcomes are achieved, how are outcomes measured, and what does good outcomes look like, please?
I'm happy to come in the first instance. Colleagues, feel free to. So I think good outcomes on an individual level is about outcomes that are identified within the support plan, isn't it? Because it goes from referral, assessment, through to a support plan. And we measure those outcomes. So within that agreed support plan then, there are a range of indicators, if you want, or targets that are set. And then the judgment in terms of whether that's successful, is whether those outcomes have been delivered. There's a range of national indicators. So, for example, we are currently delivering 75% of team around the family interventions closing with a positive outcome based on that agreed support plan. But they will look very different. I guess I'm teaching colleagues to suck eggs, for different households, for different families, for different children and young people. So it's set out in that support plan. The method of measurement, there are a number of national indicators. We've moved away from some of those to more local. There are things I would argue, like in terms of positive outcomes, we talked earlier, and the term was used around escalation or even de-escalation in some instances. Part of this judgment is, has the outcome or has the intervention been successful? Arguably is partly impacted on whether we're seeing re-referrals. Are these, I think it was Councillor Clark at the outset, asked the question around, it was around dependency, wasn't it, and changes, and we're going to be judged ultimately if these young people are bouncing around the system. Then yes, different issues could present in one's life, but ultimately the biggest measure for me is, are we then sending these children, young people or families off in a way that they are then more self-reliant, and then they are not escalating and coming back in as repeat referrals? So in terms of what does good look like, it looks different for probably every child, young person and family. It is articulated in terms of a support plan, and then we will judge with stakeholders, and more importantly with the young person, as to whether those priorities or those targets have been delivered. There are indicators nationally, like Team Around the Family, which we are reporting positively on, but I think it's far-reaching, Chair, would be my question, would be my response in terms of what do good outcomes look like, because I could probably offer a list as long as my arm, but they will differ from family to family based on presenting need, I would suggest. So we do measure. We are getting better at identifying young people sooner, as we described earlier, but it will look different from family to family. I don't know whether colleagues, I can see Ian.
Yeah, I think Ian and Lindsay both want to come in as well.
Okay, thanks, Chair. Just to build on Mark very quickly, really, the 4 areas for scrutiny I think would be helpful. First of all, I think Mark has touched upon is the quantitative outcomes that are reported regularly within corporate performance assessments, and obviously they come to scrutiny and then are formally reported within the annual report. So they're captured there from a quantitative point of view. We'll also engage very clearly with regulators. There was a meeting just before this scrutiny meeting this morning that I had with Estin, and I'm sure Ian and Claire's World, they would mention where we meet with their regulators also, so they monitor our performance very carefully. As Mark alluded to, there's obviously alignment with national measures and also Welsh Government expectations within the statutory guidance as well that we must pay regard to. So obviously that's a key element of our report. And interestingly, I think we've all touched upon, and I think it was a very good question you asked earlier, Chair, with regard to how we get feedback from young people, because what we do get in this council, which is great, we get direct feedback from young people around the performance. So, for example, just to give members one that was probably, I would say, our best received presentation during the entire last 18 months was when a young person from Bryntaig came to give a presentation to head teachers in the Team Bridgend event, when they talked about direct impact on the pandemic with them, and they provided feedback very candidly around the support they'd had from the school, the support they'd had from local authority, and this particular young person took it upon himself to conduct a national survey and fed those results back to Team Bridgend. So I think that direct feedback from young people is really important, and I know that the leaders on the call, and I think myself, the leader, and Councillor Smith, we've attended several meetings with young people and primary school age as well, where we've had that feedback directly from them. So I think it's those 4 elements, Chair. Thank you.
Thanks. Do you want to come in now, Ian, as well?
Yeah, thank you. And I won't repeat the points that Lindsay and Mark would say, but only that we look at outcomes in the same way in terms of children's social care. I think it's important to remind ourselves that children's social care implemented the outcome focused model of social work in November 2020. And when we did that, we provided all of the staff within children's social care of training in respect of how to deliver that model. Managers have been trained in terms of how to deliver that as supervisors and as mentors to our staffing group. So the ethos of delivering outcome-focused social work is the golden thread which goes throughout children's social care, and that's reflected in the way that we work with families. So in terms of the interventions, that's in terms of how we review plans, it's in terms of how we assess plans. And the crucial bit for us is that children and families are at the centre of setting their plan, but it's outcome focused for them. So it's about what they seek to achieve. And we look to work hand in hand with families. So we don't do two families. We look to support them to identify their personal outcomes. And then we review if they're, if they're able to achieve them. And if they're having difficulties, we look at different ways to support them. Now, that allows us as a department to be able to review the progress we're making with individual families, but then we've also got the wider range of data that Mark's talked about in terms of those national indicators, in terms of the work that we do, certainly as a management team and a senior management team, in terms of quality assurance and engagement. So there's a whole range of options that we've got in terms of looking at those outcomes for children and families in Bridgend.
Okay, great, thanks. I've got a few more questions on this item. I'll try and be quick with them. Firstly, relating to education, how did COVID impact on education of children coming into care during the pandemic? Now, as a mum of 3 children with homeschooling, it's difficult enough, I appreciate, when you're trying to homeschool and you're having work sent to you, but when you're a child that's moving out of one setting into another, how was the education of that child maintained? Thanks.
Thanks, Chair. I'll come in with the school-based approach and how we're supporting families there. I think, as Mark has mentioned earlier, one of the things that we always try to do is to provide wherever possible consistency for young people, and that's a key thing. And we've worked very closely with schools, actually, as you know, as a parent, over the last 18 months to provide support both in schools and out of schools, and that's been the same for children who are care experienced and also learners in school. I think we've tried our best to provide additional resources for all learners. For example, one of the things we've done over the last 18 months is provide individual online resources. So, for example, with regard to internet connectivity and one-to-one devices for all learners to make sure there's an equitable playing field for everyone, and that's been well received, certainly from the feedback we've had with schools. And what we've tried to do, we've tried to be very clear that whatever learner has been educated, whether at home or in school, there's that same learning experience, that same high quality learning experience. And I think, Chair, one of the things that you'll be aware of from other scrutiny meetings is that we've been looking to work very closely with Central South Consortium and in conjunction with our education engagement team to make sure it's a very consistent offer for all learners. And that's certainly been the case from an education point of view over the last 18 months. From Claire's world, with regard to if there's been bespoke support for care experienced learners, I need obviously then to have a view from Claire's team.
Thanks very much, Lindsay. I'll probably bring Ian in here, if that's all right, just to talk a little bit about the work of the Care Experienced Children's team, new team, but formerly in the safeguarding team, in terms of our children looked after.
Yeah, thank you, Claire. I think it'd be useful to talk about the ethos of a team and why the team was created. It was partly created because we talk to children and young people in terms of their experiences of being care experienced and the support they wanted to receive. Certainly, Mark's talked about the challenges of engaging with young people, but sometimes we do have the opportunity to engage, particularly with some of our young people as they're going into adulthood, about their experiences in care. And the ethos of that service we developed really in conjunction with young people, but also with our management team and our staff, is around being able to provide that direct work to children, being able to undertake low-level therapeutic work with them, being able to take them on their life journey work with them, and being able to work sort of hand in hand in terms of providing a more intensive form of support. So within our safeguarding team, social workers were often, I think, firefighting, I think it's fair to say, and didn't think they were able to give the time, care and attention they wanted to sometimes to some of our care experienced children. There won't be the same challenges, although there will still be challenges for social workers working with their care experienced children's team, because they will only have caseloads of children who are past their care proceedings in terms of the care system. So we're feeling really positive. I've certainly met with the team a few times since they've been created. There's a brilliant team togetherness. Everyone has that value base, which we want, don't we, as corporate parents in the local authority, of focusing on improving outcomes for care experienced children. And I think it's a really positive move forward for us.
Great, thanks very much. I've got a couple more questions here. 4.21 of the report refers to a cost saving to the local authority of 735,676. I just wanted to be assured, because to refer to something as a cost saving in such a report, I wanted to be reassured that the children returning to the home was for the proper reason. They returning to the home for their well-being rather than a cost saving, because the way it's worded, it just made me a little concerned. So do you want to do that one first? Thanks.
I mean, first of all, my apologies if it came across as in a way that suggests this was about saving money. It was just for me. We've talked extensively throughout this morning's meeting about grant funding, and I suppose it was an opportunity for me to set out the potential savings an local authority does make on the back of some very good work by not just the social care, early help, but those placement support workers. We would only, as a local authority, ever consider placing children back at home if it was in their best interest to do so and there being a proper assessment undertaken. And that we believe that their needs could be safely met back within the home environment. I think it was, I suppose I accept that it was about setting out the over if those children did remain in looked after throughout up until their 18th birthday, there are significant costs to the local authority, but by them support alongside safely returning home to their parents' care and families' care, we as a local authority, we do potentially make significant savings.
Thanks. Claire, do you want to come in?
Just to add and to provide additional assurance to Steve's answer there, in addition, where we've done that very detailed work, and it often is very detailed work over a long period of time, around reunification, as it's called, of children with birth families, that care plan has to be presented to the family court. That the child has their own court-appointed guardian from CAFCAS. So the scrutiny of that multi-agency frequently recommendation to the court from us as a local authority is very, very robust and significant. I think the point being made is that not only is it more effective frequently for children and young people, it's also more cost effective, because the costs of these out of area placements are very, very high in some individual cases. The opportunity cost of that in terms of those more preventative early intervention services is very high then, and plays to some of the discussion that we have been having. And sometimes the outcomes from those very expensive placements aren't brilliant either. So, you know, just to provide that additional assurance in terms of the level of scrutiny which these decisions and recommendations go through before any decision is able to be implemented.
Great, thanks. Councillor Hugh David, you had your hand up, but it's disappeared. Did you want to come in?
Only to underscore that Claire's made the point I was going to make around this decision not being a decision of the local authority alone, but it's a decision that is often made by the courts. There's independent reviewing officers, there's guardians. The welfare and safety of the child is always paramount. In fact, costs cannot be considered. It has to be about what is best for the child, and certainly that's clear from the courts. That's clear with the social workers as well. So wanted to provide that reassurance. and there's a number of safeguards in the system to make sure that that is always the overriding consideration for decisions made around children. Thank you, Chair.
Great, thank you very much. The last question I've got on my list is, can you give examples of what services have waiting lists, significant waiting lists, and the potential risks to children and young people if these continue? Thanks.
Chair, I'm happy to pick up from my world in the first instance. I indicated at the outset the 20+% increase in referrals. We do have, so these are early help referrals, so I want to reassure these are not child protection referrals, so we've got a joint screening arrangement there, so there's some reassurance at the point of referral at least that they're not reaching those kind of thresholds. But clearly, as I said earlier, early intervention means early intervention, and we've got, as I speak today, I think 160 plus referrals waiting assessment at the front door. So that's a waiting list. We're looking at the model of delivery at the moment within early help to try and ensure that from point of referral to point of intervention is quicker. Clearly, the assessment process is important because you need to identify what the needs are. But I'm happy to go on record to say, whilst the services are well received and regulators and others are very complimentary around early help services, one ambition I have is to get to that point of intervention and support sooner. So 163, I think, referrals waiting screening. They will be done, so it's an initial screening. Those will be done quite quickly, but that's a waiting list in essence. We also have, in my world, the waiting lists aren't predominantly for family support. We have capacity to manage a step up and step down, could always do with more, but you'll have handfuls there whereby they're waiting allocation. The biggest waiting lists are for emotional wellbeing support, as I indicated earlier. So you've got emotional wellbeing support for youths rather, in terms of youth support. There are some significant waiting lists for those. Ditto for school-based counselling, community counselling and play therapy. So the waiting lists within my world are predominantly linked to supporting children and young people over and above the front door arrangement and the screening and the assessment with their emotional wellbeing needs. I don't know whether Ian or Claire want to come at it.
Yeah, we don't have waiting lists, and that's not to do with the pressures in the service. We deliver statutory services, but we've talked about a whole system approach within this strategy, haven't we? So there can be an impact where there's waiting lists in terms of other services that we need to refer to. So when services have waiting lists, that means that often in terms of those care and support plans I was talking to as outcome focused plans, sometimes we're not able to achieve outcomes because those services aren't being able to be delivered. That can sometimes mean that children have to be supported by us on a care and support basis for an extended period, or potentially on the child protection register. So there are implications for waiting lists. That isn't to say that there aren't significant challenges in terms of children's social care at the moment. Members may have read about the huge challenges there are in terms of recruiting social workers at the moment. It often means that we need to take a whole service approach in terms of children's social care, in terms of how we meet the needs of children and families. So at times that can mean that we have to ask a social worker from one part of the service to support another part of the service, because some of the challenges that we're facing. We continue to be really focused on that. I know from Claire's perspective, as corporate director, the focus on recruitment and retention and the sort of emotional wellbeing aspect of our workforce is absolutely crucial if we're going to continue to be able to meet the needs of all the children and families in the population of Bridgend.
Thanks very much. Right. Okay, did you want to?
Yeah, I don't want to repeat anything that Ian has said, because he's answered far better than I could, but just to emphasise that point really, in terms of the impact of the early help waiting times on the statutory services. So I think the point I made in the introductory remarks, we need the whole system to operate, for any part of the system to operate as it needs to, as it should. So any child or family being delayed, if you put it that way, and get that early help service means that additional pressure is put onto the statutory side of services, either because that situation needs to step up, or we can't step down as quickly as we need to. So we're all in this together in terms of getting the right capacity into the right parts of the system, and we're very much working together to address that.
Great, thanks. I think Mark's indicated to come back in.
Only a very quick point, just for clarity, just reassure members that there's no reason why any cases can't step down from statutory services at this point in time. Clearly, it's an ever-changing position, but the waiting lists that I indicated earlier are not linked to not being able to take step-down cases from statutory. In fact, we oversaw one yesterday. So, you know, where that's right and proper, because, you know, we don't step down for the sake of stepping down. There's got to be a purpose of that early intervention as well. To be frank, we're not a babysitting service. It needs to be a very clear intervention. But there are no waiting lists. I think it's important to stress that the waiting lists I've indicated are more for, you know, your school-based counselling and supporting anxiety, mental health type issues. Thank you, Chair.
Okay, thanks very much. Has anyone else got any questions on agenda item number 4? Right, okay. The committee then is requested to consider the recommendations of the cover report set out in paragraph 9.1 on page 14 of the agenda pack. Have I got a mover for this report, please?
I'll move it.
Yeah. Thanks very much. And someone to second it?
I'll second it.
Thanks very much. Can I thank officers for the detailed responses you've given to all of the questions that have been put forward today. I was extremely impressed by the quality of the answers given. Anyone who's not needed for the next agenda item number 5, you're welcome to leave. I don't know, as we've been going for 2 hours, if you want a short break before we join into agenda item number 5. What does the committee want to do? Does anyone want to break, or do you want to just move straight on to agenda item number 5?
Chair?
Yeah.
Yeah. May I recommend a 5-minute break, please?
Okay, great. Well, we'll take a 5-minute break. It is 11:24. If we come back at 11:30. Great, thanks very much.